Good evening and thanks for joining us. Lots of developments this Friday, starting with a lifeline for companies whose business has been killed by this virus. The federal government will subsidize the wages of employees in small and medium-sized businesses, part of a sweeping new aid package. It will cover 75% of workers' wages, an increase from 10% announced last week, and it will be backdated to March 15th, so employers can hire back people they've already laid off. As well, the government is offering loan guarantees for small and medium-sized businesses of $40,000, and it will be interest-free for 1 year.
Our hope is that employers who are being pushed towards laying off people because of COVID-19 will think again. And for those of you who've already had to lay off workers, we hope you will consider rehiring them, given this payroll support.
The Bank of Canada is also moving quickly. It slashed its benchmark interest rate again, reducing it to 0.25%. That's the lowest the bank believes it can go. Governor Stephen Poloz also announced plans to buy up debt to try to keep money circulating in the economy. He says he's doing all he can to keep the pandemic from tanking the economy.
No firefighter ever got criticized for using too much water.
All of this is designed to keep businesses afloat through the worst of this so that they can get up and running again when it's over. David Akin reports.
A barber shop, its chairs now empty for 2 weeks.
We have to take this decision, safety for my team and for my clientele.
But a decision that comes with costs. With no revenue, thousands of business owners have had to lay off employees. But now, new help, which Ottawa hopes will let business owners bring back some workers. A massive wage subsidy. Employers will see the federal government cover 75% of the payroll, backdated to March 15th.
I think it's good. It's a good percentage. And it's a very, I feel it's very good for the Canadian citizen.
In addition, a new government-backed loan worth $40,000. Businesses can also defer submitting their GST, HST, and other federal taxes until June. That's a move that amounts to an interest-free loan. Now, many details will not be announced until next week. How big a business, for example, will be eligible for the wage subsidy, and will there be a cap? But one of the federal government's goals with these measures is to slow the number of new employment insurance claims made at Service Canada centres which the federal government closed to the public Friday out of safety concerns.
The health and safety of the Canadian public and also to our members that are serving the public. And that's been our main focus all along.
The government wants to move all applications for EI online or to the phone, a move many found frustrating.
Their offices are all shut. You can't talk to anyone. Try calling the phone lines. Call first thing in the morning. The line's busy. You can't get through. The call demand is ridiculous.
Now, these new measures for small and medium-sized business obviously are for immediate relief, but they're also important to help keep employers and their workforce together. And that is going to be critical to make sure the economic recovery is as strong as it can be and as quick as it can be once this health crisis passes. Dawna?
Okay, David Akin in Ottawa, thank you. Let's look at the numbers now. Everyone's watching the numbers across the country. More than 700 new cases were confirmed across Canada today. BC had 67 new cases. Quebec once again had the biggest daily spike, 392 new cases there. 10 more people died in Quebec. That brings the death toll there to 18. In Canada, more than 4,700 people have now tested positive. 55 people have died. Every province and territory except Nunavut has detected the virus. And as you can see, the numbers are going up right across the country. Quebec, Ontario, Alberta, and British Columbia are hardest hit. Ontario Health Minister Christine Elliott said that province is using every tool possible to inform the public about the critical steps they must follow to limit the spread of this virus. Ontario has been sending out emergency alerts to cell phones, radios, and televisions. That's the alert. It demands travelers who have recently returned to Canada must and are required by law to stay home and self-isolate for 14 days. That means no shopping or visiting family or friends. Many of the recent cases in Canada are among people who have returned from traveling. The head of the World Health Organization says the chronic global shortage of personal protective equipment, or PPE, is now one of the most urgent threats to our collective ability to save lives. Without that gear, healthcare workers get sick. In some cases, they're dying. PPE and ventilators are now a far more precious commodity than oil. We're hearing already about rationing and shortages in Canada. And as Abigail Beeman reports, some doctors are even soliciting donations.
We have over 10,000 hits across those websites. It's essentially a resource for the public to know what they can donate.
Dr. Sunny Johal is an emergency physician so concerned about personal protective equipment on the front lines, he started Mask a Hero, connecting donations with hospitals in BC and Ontario that need them. Some hospitals are already rationing masks. Thursday, Prime Minister Justin Trudeau promised more equipment.
Millions more items that are necessary.
But when will they actually get to hospitals in need?
And I can't give you an exact time or date for all of the various pieces and types of equipment, but rest assured that we're looking across the globe and also obviously in Canada.
The federal government is working with the provinces and territories and their different needs as officials everywhere stress the need to stay home and keep physical distance. BC now has early evidence that it's working.
The planning that's being done should allow us to adequately care for everybody who needs it. So much of that depends on us all doing our part to keep this from going explosively.
There is also worry about enough equipment for patients as well as healthcare workers.
We have limited number of ventilators. We know a certain proportion of these patients will require critical care and ventilation support. So I worry about that being exceeded and deaths being higher than they need to.
That scenario being planned for too.
We intend to have ventilators available to whomever needs them. But yes, we have an ethicist that is at the command table. We are building out an ethical framework.
Choices about who gets help, no one wants to have to make. Abigail Beeman, Global News, Ottawa.
We know you have lots of questions about this virus. Our Jeff Semple will continue to consult with experts and try to answer them. Email your questions at globalnews.ca, and our website also has a special page dedicated entirely to COVID-19. You can visit globalnews.ca/coronavirus.